Good morning, everyone. Welcome to this COVID-19 webinar brought to you by the National Institute for Occupational Health. And our topic today is the Occupational Health Surveillance System, the OHSS, and specifically the CSV new platform and data submission demonstration by our colleagues from the epidemiology and surveillance section of the NIOH. Um, and I'm not going to say much further. We do have some online virtual house rules. Please type your general comments and so on and questions, general stuff in the chat box. If you've got specific questions for the presenters, please type those questions in the question and answer box. That'll be much appreciated. A general certificate of attendance will be circulated after the event. And so without much further ado, the OHSS is a critical tool for us to ensure that we can promote workplace preparedness as well as prevention when it comes to the occupational health challenges that are there, particularly COVID-19 as an occupational health challenge. And therefore, it is great to have the team, that is Professor Nisha Naika, Lesedi Munawia, as well as Notlanta Totleng and Monty Rambau on the team today to give you the program as we'll have it. And so without further delay, I'm going to ask Professor Nisha Naika just to do the welcome to this particular webinar and to place everything for us into context in terms of the latest developments with regard to this particular platform and this particular tool. And over to you, Prof.
Thanks, Ashraf, and thank you everyone for joining us today. So, as you are aware, because you are here, that there were significant changes that happened in the OHSS from the 1st of August. And we have done this so that we can comply with the Department of Employment and Labor directives and the UIF directives. So this entailed adding new questions to our templates. And the Nextcloud system was also replaced by the CSV upload, which Lesedi and Nonshlanshla are going to describe, as well as Monty today. And we've done this, we've replaced the Nextcloud system because it wasn't as efficient in order to give us the data quality that we wanted. As you know, employers were allowed to submit Excel spreadsheets or CSV files, and the templates were not always matching, so that the data extracted was not always of a good quality that so that we can analyze and provide feedback. And so in order to prevent this from continuing, the CSV upload system was developed, where there's multiple checks and balances built in. But then again, with every new system in place, there's always challenges that are being experienced. And because of the queries that were coming in, we thought that this will be an ideal platform so that Lesedi and Monty and Shansha can demonstrate what is the correct processes to be followed and how to prevent uploading errors to occur. So without me going on and on about it, I'll just hand over now to Lesedi and Nonshlasha so they can show you how to proceed with this new platform. So over to you, Ashraf, to introduce Lesedi. Thank you.
Thank you very much, Prof. Naika, for that welcome and contextualizing the latest developments and the need for the adjustments and improvements in this particular platform. So without further delay, I'm welcoming Lesedi as well as Nonhlanhla, who's going to deal with the CSV platform user demonstration. And this involves how to log in into the new CSV platform, changing user password, completing data submission template, and the template involves the COVID-19 positive cases, the return to work aspects, vulnerability data, and symptom screening data. And we may be able to engage subject to time in a bit of question and answer towards the end of the slot, before we proceed to the next slot, and that slot is the topic troubleshooting during data submission for the a CSV guide that Monty will present when his slot arrives, and then we'll have the general question answer session towards the end. And we look forward to you asking your questions both in the question answer box, and we will see how we manage perhaps more creatively the question answer session towards the end. And so if I could just, and I didn't prepare this, quickly get the brief introduction. So our main speaker is Lesedi Monawa, and Lesedi is a project coordinator for the Occupational Health Surveillance System platform here at the NIOH, and she's a member of the Epidemiology and Surveillance Department or section here at the NIOH. I hand over to you immediately, Lesedi. If you could just share your slides, and then we'll check on your audio, and then we can proceed with your presentation with the support of Nonhlanhla. Yeah, if you could just maximize your slides, that'll be great. So a quick reminder again to our attendees, please just type your questions in the question and answer box. If there's something that you want to, desperately clarify after the presentation, I'm going to encourage you to raise your hand, and we may be able to accommodate you by having an open microphone facility for you. I now immediately hand over to Lesedi. If you could just check your audio, Lesedi.
Hi, Ashraf. Hi, everyone. Can you guys hear me?
Yes, perfectly. There is a little bit scratching on your microphone. If we could just be mindful of that. In the meantime,
Okay.
I hand over to you, and you can please proceed.
Okay. Thank you so much, Ashraf. Good afternoon to everyone. My name is Lesedi Monaiwa. As introduced by Ashraf, I'm the project coordinator for the OHSS. So without wasting any time, please allow me to begin with my presentation. I will be doing this presentation together with Nonhlanhla Tlotleng. Nonhlanhla, I don't know if you want to say hello.
Good morning, colleagues. So my name is Nonhlanhla, also from AP. So we're working on the OHSS with Lesedi operation. So please feel free to ask any questions that you may have on during the presentation, especially on how you fill your template and submitting your data. Okay, you can proceed, Lesedi.
Okay, thank you so much, Nonhlanhla. So I'm just going to touch a little bit on the background of this presentation and the CSV platform. So the CSV Upload Platform replaced the Nextcloud, as Nisha has mentioned earlier. It basically serves the same purpose that Nextcloud did, whereby it's a system developed to help businesses that do not have electronic systems in place to help them collect the COVID data in the workplace. So we developed a system to help those companies to use our prepackaged CSV data templates to collect this data and therefore upload it on our system. So this means that all our participants that used Nextcloud therefore were migrated to the CSV platform. There are actually 4 templates that we've developed to mesh our system, which have been sent out to all our users to use in terms of capturing the data and therefore uploading on our system. These templates are the return to work template, the symptom screening template, vulnerability template, as well as the positive case template, which covers all the type of data that needs to be submitted to us. The templates are available on our OHSS homepage. On the screen there, you have the link to our homepage where you will see the 4 templates. The purpose of today's training is to train our users on the new CSV platform and to also address all queries relating to the new platform, including the technical queries. The training will cover navigating on the CSV Upload system. We will also give a demonstration on how to fill the prescribed templates, how to convert the Excel to CSV, and how to upload CSV on our platform. And also we'll cover on how to log into the new CSV platform. We'll also cover changing the your user password, and also completing data submission templates, which is the positive case template, return to work, vulnerability, and symptom screening template. So in terms of logging into the system, this is the homepage of the OHSS surveillance system. When you get here, you have to click on the Upload CSV tab. And while you will get to this page, this is the tab where you'll have to click Upload CSV, and then you enter business ID, which was provided by us during registration, and the password received after registration to log into the field and click the login tab. If you're previously using Nextcloud, you need to reset your password first on the new platform before you can actually log into the system. So what you do is, if you migrated from Nextcloud to this platform, you come onto this page, click Upload CSV, you put in your business ID, and then you put in, you click on Forgot Password. And therefore, you will have to put in your business ID as well as email address that was used during registration. You remember, you can't use the password that you used to use on your Nextcloud platform because this is a different platform. So you need to put in your business ID, which is still the same, and email address that you had put in when you were registering the business, and then you click on Reset Password. And then after that, you should receive the password reset email. It'll look like what you see on the screen right now. And then you will click on here on this blue link to set your password. And therefore, it will allow you to set a new password. This is how it will look like. And then you'll put in your new password and you repeat it here to confirm it. And then if everything is in order, all the red crosses should be, as you put it in the password, the red crosses will turn into green errors to show that you are actually following the right order and your password is right. So as you put it in, everything should be green here. If anything is left red, then it means that something is wrong with your password. Have a look at it. If it's on special character, it simply means that your password is missing a certain special character. You can put maybe a hash or an @ sign or percentage sign, and then everything will be good to go. And then you click on Reset Password. And then once everything is good and you've clicked on Reset Password, you will therefore, it will let you know that your password was successful, your password reset was successful. And then you therefore proceed on to the login page. You put in your new business ID, you put in your business ID and your new password. Then it should bring you to this screen, which is the dashboard of our system. And then when you get here, you'll be having these 3 tabs: company information, upload CSV file, and submission history. Company information, basically, this is where you will click on in order to modify the data that you had entered during registration. For example, if you need to upload the contact person that we have on the system, if you've got someone new, you can click in here and then you put in the details of the new person who will be managing this account. Sorry about that. And then on submission history, this is where it will show all the files that you have submitted. But please note that on this system, it will also show files that have been submitted from the 1st of August. Data that was submitted via Nextcloud will not reflect on this tab, simply because we have backed up the data in our data lake. We have it. You do not have to resubmit it. However, it will not be available on this function, on this portal, because the templates are quite a bit different. But you do not have to resubmit it. We have it. And then you come and click on to upload CSV. This is when you want to upload your files. You click there and then it will take you to the screen. And then this is, you click onto submission type. This is where you will select the type of template that you want to upload. For example, if you're uploading your vulnerability data, you will select vulnerability. And therefore, this is where you will click on browse to actually select the file that you want to upload. And then you fill in the name, your full name and your surname as the person who's uploading the file. You click on check CSV. This is what your screen will look like if everything is in order. This is on the left is actually the template of the expected data from the template that you're trying to upload. And then this on the right will be your actual template that you are uploading. So everything needs to be in the same template as the one on the left. If something is wrong, it's either an error message will pop up, the green button won't be there, and it will reflect here that probably maybe even if your ID number is incorrect, you will be able to see it here, or it will just be blank. If the entire CSV document is incorrect, there won't be anything on the right, it will be blank. So the CSV upload procedure, you select a template submission type. As I've said before, on the drop-down menu, select your CSV file that you need to upload, enter your name and surname, click on check CSV file. If there are any errors, like I've said before, with your CSV file, the upload file for processing, the green button will appear. But if there are any errors detected, they will be displayed in the notification area detailing any issues detected. Possible errors will be displayed later in the presentation. And then you therefore click on upload file for processing. This is if everything is in good order, there's no error message popping up, and your green button is there. Your file will then be processed into the OHSS data lake. You will receive a final message confirming the file upload status. If the file was not successfully loaded, there will be a message that will indicate an error encountered during the upload, such as incorrect file format. But if everything was submitted well, then it will also notify you that the submission was successful. And you can also go onto submission tab to check if your file does reflect there as on the submission history. But also please note that currently our submission history function has got some technical issues that our IT team is currently working on. Some files do not update and show immediately on that tab. But as long as you did get that message that your file was uploaded successfully, you do not have to re-upload it or panic. We are receiving the data. So moving on to the prescribed CSV templates. So this is how the screen will look like when you get onto our OHSS homepage. It will look exactly like the screenshot in my presentation. And here in red, there's actually the 4 templates that are prescribed to use. Please note that data submitted by any other template from the prescribed ones will be automatically rejected by the system, and submission of file will not be processed or possible. Like I've mentioned before, the prescribed templates are available on our homepage, as you see on the screenshot below. Data submission templates are available as Excel sheets on the OHSS page. After entering the data, the templates are saved as CSV MS-DOS documents. Please note that the only form of CSV that the files should be converted to is specifically the CSV MS-DOS, not any other. Also, users should not change any formatting on the data, on the templates, add any column to the templates, or move any field on the template. The templates are used as they are for data submission. Should you do any edits, like adding an extra column to the template, your file will definitely be rejected, because now the templates have been designed to match the system as is. So the first template that I'll be discussing is the symptom screening template. This is how it basically looks like. The first column is the business ID, where we actually put in the business ID that was generated during registration. Please make sure that your business ID is correctly captured into the template. If it's not correctly captured, the system will reject it. The SAID or passport number template, the SAID or passport number template column is the second one. Do not switch columns, probably making the first column to be business ID and the to be the SA ID and the second one being business ID, because that will cause your file to be rejected. So you just keep it as is, as well as the spacing or even some errors that could be picked up from the headers. Do not correct them, do not edit them, just leave it as is. If there's an error you've picked up, please just send an email to administration and we should amend it on our side. So passport ID, the system, passport or SA ID, the system expects 13 characters, which is 13 numbers. It does not take anything less than that. If the ID number is not 13 numbers, the system will automatically reject your file. If the passport, for the passport numbers, if you've got an employee that uses a passport number, simply add 5 zeros at the end of the passport number to make it a 13 character digit, so that our system will be able to actually accept it. We have also added that information into a CSV upload guideline. So if you look at it, it will actually tell you that what you need to do in cases of passport numbers. And then the screening date, this is the date when the screening is being done at work with the employee. So you put in the date, also on the date format. This is the format that you see on the screen. This is how you should put in the date, starting with the year, month, and then the date. Any other format will be rejected. And then the employee age, we expect 2 numbers, that's it. Gender, this is a drop down column. It's got drop downs in terms of options that you've got there. We have got either male, female, or other, so you'd have to choose between those. And then job category, we also have a drop down list of the categories that you can choose from. You also do the same. You can't manually capture the job category. As well for province, we also have a drop down list there. District, we also have a drop down list there that you choose from. Symptoms present, we've got yes or no. So if the employee was presenting with any symptoms, it will be yes. And if there are no symptoms, it will be no. And then from there, the next columns are for symptoms that the employee would be presenting with. So if the employee's got fever, it will be a yes. If no, it will be a no. These are still drop down columns. Same applies for all of those symptoms. And then we get to screening outcome. No action required. If upon screening, there was no action required, either to refer the employee, then it will be no, if no action has been taken or required. If there is an action required to refer the employee, it will be yes. And then screening outcome referring for self-isolation, it will depend whether you referred the employee for self-isolation. That will be yes. If not, it will be no. And then screening outcome referred for testing, same applies, yes or no. Screening outcome referred to the doctor, same will apply, a yes or no. So this daily symptom screening data, all employers are legally required to screen all employees entering their work premises on a daily basis. This screening must be based on the prescribed set of symptoms as has been defined by the NICD, the National Institute of Communicable Diseases, to determine those persons likely to be presenting with the COVID-19 infection and therefore should be referred for further assessment. This daily collected data must be submitted by employers for those employees that are symptomatic. The data must be submitted on a weekly basis. Should there be symptomatic workers recorded during the calendar week? The submissions should occur before Tuesday for the previous calendar week commencing on Sunday. The next template, we have return to work template. It looks like the one that I have on my screen. So this template, it covers the data upon employee returning back to work. recovery from the infection will vary based on vulnerability and other risk factors. Understanding the outcomes of the infection among employees provides critical information. All employers who indicate employees have tested positive must submit information about the outcome of the infection and the return to work decision. No confidential clinical information is required. This data must be submitted once only when the employee returns to work. The data required are listed in the return to work template, which we have as our headers here, which the first column is the SAID number or passport number, employee work ID. So on the employee work ID column, this is an optional column. If you guys don't have any employee work ID in your companies, you can leave the column blank. And then the next one is the business ID column, which is the business ID that you received during registration. Please make sure that it's 36 characters. It's the right business ID, as I've said before. The date's the same format. So this format applies across all our templates. Date must always be in year, month, and then date as stipulated in the templates. Province is also, it's a drop-down list column. You choose your province there. District has also a drop-down list of all districts in the country. Industry, we've got a drop-down list of the industries. You would choose them accordingly, as well as job category. Also, there's a drop-down list. And then we get to whether the employee has been or was hospitalized. So here is a drop-down list of yes or no or unknown. So you choose the relevant one. And then hospital type, we've got public, private, or unknown as well. So obviously this will be filled in should you have said yes on hospitalized. If you've said no, you can leave this one blank. As well as date admission, you would leave it blank if the person wasn't hospitalized. But if the person was hospitalized and you have said yes here, you'd have to put in the details on the hospital type, date of admission, outcome of hospitalization, whether the person has been discharged or it's death or unknown, as well as the outcome date. And then outcome date, this is if the person was hospitalized, when was the person, if the person was discharged, when was the person discharged? This is the date that we're looking for on the outcome date. It's outcome of hospitalization. And then if there was no hospitalization, the fields will be left empty. And then we get to return to work date. If the person returned to work, when was the person back at work? This is the date that we are looking for here. And then when the person returned to work, was the person fit for job description? So if the person was fit for job description, you would select that. If not, you will specify with the drop-down list. And then we've got compensation claim. This is, we have a yes or no, or you can leave it blank if it does not apply to you. If, for instance, you went and claimed on the COIDA compensation, you can actually claim there, which is the Compensation for Occupational Injuries and Diseases Act. If it's relevant, if you made a claim, you can say yes. Disablement, if the person is disabled or could not come back to work due to illness, it will be yes. If not, it will be no. Start date of illness. This is the date where the employees probably started falling ill for due to COVID-19. So we need the date written there in the same format that is expected. And then the illness type. This is where we want to know whether the symptoms or that the employee presented during illness, was it mild symptoms or were they severe or moderate? So we've got only 3 options: severe, mild, and moderate. So you will have to choose the relevant one. If there were no symptoms, you would leave it blank. And then at end date of illness, we want to know when was the person fit or healthy enough to actually say healthy to actually go back to my normal activities. this is the date that you put in there. And then the claim reference number, if there's some claims that you've made, you can put it here. If there's no claims that you've made, it's you leave it blank. The next one that we'll be discussing is the vulnerability worker data. All employers are legally required to identify those employees who are considered to be vulnerable for the more severe outcomes of the COVID-19 infection. Since this is a key component of the screening of workers, this data must be submitted by employers. The vulnerability status of each worker that is submitted is not dependent on the availability of detailed medical information being available to the employer. This once-off submission is submitted when collected data by the workplace or any subsequent occasion when new appointments are made or an employee status requires updating. The data required are listed in the template up here on my slide. So in this template, we have the SAID, passport number column, business ID, and then also date, province, district, industry, and then we've got age, and then we also want to know if the employee is male, female, or other, and then the job category of the employee, vulnerability status. So if an employee is deemed to be vulnerable, as per the guideline and my explanation below on my presentation, it's definitely a yes on your template. And therefore now we've got our next columns. If your employee has asthma, if it's yes, then you will choose between yes and no. If it's no, obviously it will be no. And then we've got chronic lung disease, we've got diabetes, we've got hypertension, we've got serious heart conditions, chronic kidney diseases, chronic liver diseases, immunocompromised. If your employee is immunocompromised, yes or no. If the employee had TB, tuberculosis previously, a yes or no, or currently having TB, it's a yes or no as well. Or if the employee has HIV, or if the employee is above the age of 60 years, there will be yes or no there. Smoking, currently is the employee smoking, yes or no? Is the employee pregnant and above 26 weeks, yes or no? Is the employee obese, yes or no? Then the last column, we want to find out if the employee received a flu vaccine. There's a yes, no, or unknown on those columns. So you fill it as is, as shown or demonstrated here. So one thing also to note is that our templates, the first row is pre-populated as an example to guide you. So when filling in this template, please make sure you delete the example that is pre-populated before you put in your data or before even converting it to CSV and submitting it. Make sure that only your information is on this data and the example is not part of it. The last template that I'll be focusing on is the positive case template. The COVID-19 testing data, based on their daily symptom screening or on their employees' presentation to their health provider, employees are referred to health providers, health laboratories for testing for the presence of the COVID-19 viruses. In terms of the managing the pandemic in the workplace, the employer is expected to be notified of the results of the tests. The results of the laboratory tests of all employees who test positive must be submitted by employers upon receiving the results of such tests. In addition, employers need to submit details in the positive case template for such individuals. This submission occurs only when an employee tests positive for COVID-19 and should be submitted on a weekly basis should there be positive workers identified during the calendar week. The data required is listed above on the positive case template. So this is how our positive case template looks like. First column being date. I think my screen cut the first column here. The first column is the business ID and then the national SAID or passport ID. and then next will be the date column, and then province, district, industry, and whether the person is male or female, the age, the job category, and the test date. So the test date is the date where the COVID-19 test was conducted. You have to put it there, and then the test type, whether it's the PCR, it was a PCR test, which is a lab test, PCR antigen test. So you will say yes. So here on, we've got 3 test types there. So only one will be applicable. If it was a lab test, it will be yes here. If not, it will be no. And if it was a rapid test and the test type antibody, it will be a yes. And then we also have a third one, which is also not showing here. My apologies for that again. Which it will depend. So it cannot be yes for all 3. We actually expect the relevant test that was conducted during testing of the employee. Also, if unknown, we've got an option of unknown if you don't know whether the person, the type of test that the employee was tested with. And then we've got symptom positive column. Was the employee presenting some symptoms when testing for COVID? It's a yes or no. And then number of high-risk contact, because remember, we are also required to do contact tracing upon testing or upon a positive test of an employee. If the employee was in the office, we need to identify the people she was in contact with. So this is where you put in the number of people that are in high risk or identified as high risk contacts. And then if you don't know that, it will be unknown. And then vulnerability status is the employee deemed as one of the vulnerable employees as per the template I was discussing previously. So that will be a yes or no or unknown. And then we've got positive results action. So when the business found out or the company found out that the employee tested positive, what was the action taken? Was it self-isolation at home? Did you refer the employee for testing, for self-isolation or to the doctor? So this is the type of information that we want to find out here. And then we've got the exposure information. We've got a list, a drop-down list of the people that were actually exposed to this employee, which one of them is family contacts, or we also have one for co-workers in there. So we will choose the relevant one for this one. And then reporting actions with the Department of Employment and Labor. So if this has been reported to the Department of Employment and Labor, it's yes. And you are reporting this through to us on the OHSS system. If you've also reported the case to COIDA, you will select yes. If not applicable, you will select not applicable. We also have the option for not applicable and the option for no as well. Same applies to the next one, which is the Department of Mineral Resources and Energy. So I'm also going to touch on the important areas to look at on the templates. So employee SA national ID or passport number. This can't be left blank. It's areas, it's a column that is mandatory. You can't leave it blank. So on this area, like I've explained earlier, that our system is set to expect a 13-digit number. So you need to confirm that the ID number is correct and it's 13 numbers. And then you make sure that the formatting is also right on your sheet on this column. The number must always be 13-digit. Please always make sure that the format is a number and you format it to 0 decimal places. I've made an example of an ID number here. make sure this is how it looks like. The ID, the ID number that is in green here, this is how your ID number looks like, and not the one in red, because sometimes Excel has got a tendency of changing the format to such characters. So should you see this, please reformat it to number and 0 decimal places. For passport numbers, please add 5 zeros at the end of the passport number to make it 13 characters. For example, I've made an example here. The passport number would probably be CN2569884. Then I've added my 5 zeros. This makes it 13 characters, and therefore our system will accept it. The date format, I've mentioned it earlier. We expect it to be in the following format: year, month, and date. And then the columns and rows. So do not add any columns or rows to the template. I've made an example here on my slides. For example, do not add an extra column, probably for the employee name, like I did here on my slide. Adding a column will simply make your entire template to be incorrect and cause it to be rejected by our system. So please do not add any extra column or even a row. Leave an empty row. Probably you've just deleted the pre-populated example. Do not leave that row empty. Start capturing on the very same row, the first row. Do not leave any empty rows at the top or in between your data. That will actually cause the sheet to be rejected by our system. I've also spoken about this. Do not correct any spelling, grammatical, or spacing on the template headers. Templates have been matched with the system, like I've mentioned before. So any changes to the headers will prevent the file from being uploaded successfully on the system. I've made an example on the current spelling error that has been picked up already on the current templates, which is the spelling of conjunctivitis. We have it here as the one in red. Please do not correct it. We will correct it. Our system will be updated regularly. And during this upgrade, this is where we'll be implementing all of these corrections and changes. So should you pick up any error on the template, forward them on our to our OHSS administrators to this email, the OHSS workplace@nioh.ac.za. And we will make sure that corrections are implemented. And then on all our templates, we have a description list to always make reference to when determining which columns are compulsory and those that are optional. Below is an example from the Return to Work template. So if a column is compulsory or listed as compulsory on this sheet, it simply means you can't leave it blank. You're gonna have to choose the most relevant list or put in the most accurate information that you have on that column. So it's on all our templates, we have the description list. So always make reference to it if you do not understand what is required, what is compulsory, and what is not. And then after completing your sheet and now you want to upload it, you need to convert Excel sheet into CSV. Once data has been captured correctly, this is what you do. You convert it into CSV MS-DOS. I have marked it red here. So this is the option you select when you save your sheet into CSV, the CSV MS-DOS. If it's converted to any other CSV type, the system will reject it. And then you log on to your CSV platform, you click on Upload CSV. Then this is the screen that you will see. And then you select on Submission tab, you select the relevant one. If it's a vulnerability sheet that you want to upload, you will select vulnerability. You therefore choose your file there on your computer. Then you select the CSV file that you just converted. And then you put in your name and surname on the name and surname of person submitting there. And then you check CSV file. So those are the two screens on the screen. This is what you will see. So this is the templates headers, which will give you an example of the expected data. And then this is your header. So once you check CSV file, your header will automatically change. If everything is in order and captured well, it will definitely match the template on your left, and a green button will pop up here on the screen to upload your CSV. But if it doesn't pop up, this simply means something is wrong with your CSV file. An error message will sometimes pop up here, letting you know what is wrong. Sometimes when you look at it, also look at your header template, look at the ID number. Because sometimes you would, when you convert your template into CSV, the formatting changes, especially on the ID numbers, into some special characters. So always just verify that your ID number, even on your header, reflects as it should. And then if not, you need to go back and change your formattings and reconvert, and then try and uploading again. So this is the green button that I was talking about, that if everything is in order with your template and it matches the expected template, this green button will pop up. And you will click on it to upload the file. And then this is what you should see, the screen, the green notification should come up that CSV was processed successfully. If this green notification does not pop up, there will definitely be an error message letting you know what caused your file not to be uploaded successfully. So in this section, you will also be able to see your historical data. So this is the submission history section, which is this one, the purple one. When you click on it, you should be able to see all the files that you've uploaded. I've mentioned earlier in my presentation that the files that you will see here will be the ones that you've uploaded from the 1st of August 2021. So if your file is not here, it simply means that it wasn't uploaded successfully. But I've mentioned earlier that currently we are having an issue with our submission history function. It takes a bit of time to actually update accurately or same time the data that you have uploaded. So make sure that you do see this green notification that says your CSV was processed successfully. If you don't see that, then it wasn't. You need to redo it. This is the end of my presentation. Nonhlanhla, would you like to add something before I can hand it over to our audience for questions?
No, I think, Lesedi, you've covered everything, and because we're getting a lot of queries with everything that Lesedi has presented. So hence we thought of having this training. So, but most of the things are covered. If users shouldn't really change any formatting on the templates, and they should fill the template. Use the drop down options or leave it blank if there's no any other option, and especially the ID number. So that's also very important, because then we have trouble receiving the data, and this also lead to other problems in regards to the UIF, especially the ID number. But everything has been covered so far. So Monty will just cover the technical issues, which he will just present also following this. Yeah.
Okay. Thank you, Nonhlanhla. Ashraf, you can advise on the questions, how our audience can ask questions now.
Yes. So I'm going to invite anybody from the audience who may want to ask any immediate questions of clarification on the presentation and the slides. They can just raise their hand. There's a little raise hand function at the bottom of your Zoom box or screen.
Ashraf, we're struggling to hear you. I don't know what's happening with your mic. Maybe I'm the only one.
It's soft.
Yes,
Yes,
it's much better.
Okay, now I've got a bit of a backup microphone today because the other one just decided not to work this morning. So I can increase the volume on this microphone as well a little bit. because I haven't used this for a while. Okay, so that hopefully sounds a bit better. So yes, we've got the audience, and if anybody wants to raise any questions, otherwise we will leave you to add any questions to the question and answer box as a reminder. I do see that there is a question in the chat box from Shanita Rampathy, and I'm going to ask Shanita if she, obviously I assume it's a she, may want to perhaps also speak to our presenters. We can certainly facilitate that for you, Shanita. So the question in the chat box, Shanita, just a reminder, please capture your questions in the question and answer box. I see Wendy Hutchinson has also got a question in the question and answer box. So the first question, let me start with Shanita, is will copying and pasting on the Excel file affect the file and its accuracy? Maybe we should just start with that one. Over to you, Lesedi and Nonhlanhla, our colleagues from the epidemiology and surveillance section.
Thank you, Ashraf. So sometimes the copying and pasting, especially if you're going to be copying the information from a different Excel file, it would definitely affect the formatting on this template. So just make sure that if you've copied and pasted your information, you just re-verify the formatting on the Excel sheet that you will be uploading. And especially on the drop-down columns where they've got drop-down lists, it majorly affects this information. So just make sure that when you click on your information, it's still relevant, they're still part of the drop-down. And the information, the formatting is actually the standardized one that is expected.
Okay, so Shanita, you heard that. If there's anything you want to follow up on that, please just indicate. You did make another comment about okay, so it's a bit noisy for Shanita to work for her to unmute and to speak, so thanks for your consideration there. Okay, then to Wendy Hutchinson. So Shanita, again, just, you're invited to follow up on that if you want to clarify anything further, and that applies to all of the others as well. Wendy Hutchinson is asking in the question and answer box, mobile numbers listed above do not work, either switched off or is not answered. So my sense is, Wendy, if you want to clarify any of that, please just indicate by raising your hand in the Zoom function there. You're probably referring to mobile numbers which are for the OHSS liaison communication. If that's correct, I'm just going to ask Lesedi and Nonhlanhla to indicate if those numbers are fully functional or not. Thanks.
Thank you, Ashraf. I will take that one too. So one thing that I would also like to highlight is that both numbers are fully functional. It's 2 cell phone numbers. Since we've launched the new platform, we've been getting a high volume of queries. Literally, I could sit and be on the phone the whole day and not do anything else. So, which is what causes some of this calls not being answered, because I'll be on the phone and a call is coming through, but I cannot cut off the user who's on the line to actually attend an incoming call. So the main reason really is the fact that we are having a high income of calls, a high volume of emails coming through, and really we are doing our best to get to address each and everyone. Every user is as important to us as everyone. So number one, that is the reason. Weekends, we do not operate on weekends. We don't work on weekends. We've noted that we still receive calls during the weekend. We still receive calls after 5, after 6, around 7, 8 at night. So I think this is something that we have to probably correct on our end also, which is what we are going to do, to put up trading hours or our operational hours on the website, and as well as on our signatures and everywhere where our users could actually know when to contact us, when they'll be able to assist us. But basically it's Monday to Friday, public holidays, we are not working between 8 and 5. Thank you so much, Ashraf.
Thanks for that, Lesedi. And you've also had a thank you from Shanita for your earlier reply. And I'm sure that I'm sure the attendees and Wendy would appreciate the fact that there's quite a lot of work, Wendy, that goes into the development and making sure that the OHS system is operational and adjusted when required, as is being shared with you today. And it'll be very difficult to ask my colleagues to be working beyond the normal working hours. I think it will just be too exhausting for them to be able to do that. But yes, please try those numbers again. I mean, if you do have difficulty getting through to the number, there's obviously the email address as well that you can use in order to get through to colleagues. That's the OHS workplace at NIOH.ac.za, OHS workplace, all no spaces in between. That is OHS workplace at NIOH.ac.za. And yes, somebody will eventually get back to you. If we have more resources, we can have obviously more people dealing with your queries. Okay, so then there was a Denzik. Let me just get this slightly. Groenewald. Yes. So now, Liesel Muller wanted to ask if we could share the copies of the presentations. Yes, Liesel, all presentations will be shared with you. We normally send out a number of emails after the webinar, and one of those emails is sharing with you the links to the presentations that will be uploaded onto the NIOH's website, and the recordings of this webinar, including video and audio recordings, would also be in that email, giving you the links to those things. And yes, and you can follow up obviously with both the email and the phone numbers when necessary. You are playing a very important role in ensuring that these systems are working in all the workplaces within the South African jurisdiction. So maybe just quickly the last question before we move on to Monty, and we will have another bite at the issue of questions and answers after Monty has completed his contribution. So Denzik Groenewald is saying, could you possibly give us some insight into the process on how the system is linked to the UIF system? We are busy submitting our TRS claims for the period 16th of October to 15th of March 2021, but do encounter that some of the ID numbers cannot verify against the data on the OHS. Please, will you advise on how we can remedy this? Now, clearly, this is a question that is somehow related to the CSV platform and tool, but I'm sure you'll be able to just assist Denzik Groenewald on his question.
Can I ask Nisha to step in and just explain more on this one?
Hi, thanks, Lesedi. Yes, so if you have submitted the data correctly on our system, on the OHSS, all that data, including the ID numbers, is submitted to TERS. We extract it from our database according to the information that TERS wants, and we upload it onto a platform similar to how the NextFlood was used, and then they extract that data onto their IT systems. And we can confirm that all the data that we have has been uploaded on their system from up to the 16th of August. And this updates occur weekly. So it's sent off once a week. So if, and obviously we have no control over the TERS database. So we don't know if all the data that we have submitted to them is on their database. And what we can do is check that your ID is included in our submissions. But once it gets to TERS, you have to confirm with them. So that is the process. Going forward from next week, it's going to be an automated system where TERS will automatically, if I say automatically, but will themselves extract the ID numbers and the dates they require, including the vulnerability information, directly from our website, not our website, our data lake itself. But so if your ID is not in TERS, we can confirm whether it's in our submission list. If it's not on our submission list, then we will ask you to send us that information again, and we will then forward it on to TERS. So that's how we can assist. But after it's included in our data lake and in the sent to TERS, we cannot, there's not much we can do after that. So I hope that clarifies our role and then where TERS has to take over. Thanks.
Okay, unmute. Thank you very much for that, Nisha. I know we're slightly over time, but we will definitely give Monty all of the time that he requires. Let me go back to Wendy. It is a CSV specific question. In addition, Wendy Hutchinson is asking, when selecting the preferred data submission process, when selecting CSV file upload, an error message appears saying, and the error message states, error updating the business details, please try again. I've attempted this many times, Wendy says, with the same error message. Will this prevent me from uploading CSV data? Over to you, Lesedi or Nonhlanhla.
Thank you, Ashraf. So this is one of the reasons why we organized today's webinar, to actually address including technical errors that our users are encountering. So can we please just allow Monty? He will be covering all the errors that all our users are seeing on their screens or encountering when they're trying to upload their CSV. He is he's going to actually address all of them and advise them on what to do, what would be the reason for the errors and all that. So thank you.
And with that segue, it's important then to move over to our next speaker, who's going to deal with the troubleshooting during data submission. That is a CSV user guide. We've just heard from our two colleagues who are in the epidemiology and surveillance section and department, and that was Lesedi Monawia and Nonhlanhla Tlotleng, Dr. Nonhlanhla Tlotleng, an epidemiologist in the epidemiology and surveillance department. I am now introducing to you Monty Rambau. He is an analyst developer in the information technology department of the National Institute for Occupational Health, the NIOH. He's got approximately 16 years experience in IT from the whole range of support service infrastructure and application development and support, A.NET full stack developer experience, currently the lead developer for a significant system run in workplaces, in particular in the public health sector. It is called the Occupational Health and Safety Information System. OHSS, in brief, is the common term within those places where it is in place, including my workplace and the NHLS, and as well as with this particular system, the Occupational Health Surveillance System, the OHSS system, is where Monty is playing a key role in the development thereof. I hand over immediately, Monty. Thanks. I see your slide is maximized and shared. Just checking on your audio.
Thank you, Ashraf. Can you hear me?
Perfectly. Thank you very much. Please proceed.
Good afternoon, colleagues. So like Ashraf said, my name is Monty Rambau, and basically I will be going through some of the issues that we have picked up since the system was launched in August. We've noticed that there are some frequently asked questions when it comes to the CSV files. And while I can't address all possible errors, I'll be addressing the common ones that we've been receiving. First, I'll start with basically the CSV file. So basically, CSV stands for comma-separated values. Put simply, it means the columns that you see in the templates that Lesedi referred to, each data point is separated by a comma. And this is what the system expects. If it gets anything other than comma-separated values, it will throw out an error that says something is wrong with your file. Please check it again. I will show you later on how to verify that indeed the values are separated by commas. And some of the data and information I will share here, Lesedi has gone through it, but simply in this slide, it's how to convert your templates that you would have downloaded from the NIOH website into a CSV file. And obviously, once you've completed the template with all the required information, you would go onto the file, save as, and as mentioned before, CSV, and more importantly, MS-DOS, because it does give you some other options for CSV files, but those do something completely different that's irrelevant to this system. So once you click on save, you'll be presented with two pop-up messages. One will just say you must confirm that you will be saving to a CSV file. The second one just mainly informs that certain Excel operations will not be possible in a CSV file. This will be your maths functions, or if you have some fancy macros running. But again, these are not relevant to the CSV platform. So this, you just click OK and yes, and your file should be ready to go. So due to the different versions of Excel out there, some people are using Excel Open Office, some professional, some standard. It becomes very difficult to standardize the templates to a specific Excel version. So the most common error that we are seeing is when you say save as CSV file, and you actually check inside the file, you will see that the values are actually separated with semicolons. So we have developed just a quick way to fix this issue. First, you would locate the file where you saved it. You would right-click on the file, select Open with Notepad, and in there you will see that the values are indeed separated with a semicolon. So what you do from then on, we will need to replace all the semicolons with a comma. So once the file is open, you would press Control H on your keyboard, which will bring up this window. So basically, this will tell the Notepad program to find the semicolons and replace them with a comma. And you would proceed to click Replace All. Then you would save the file and attempt to resubmit again. This, we've seen so far it has a 100% successful rate. This is obviously depending on whether the information you've inputted is correct or not. Okay, here we're just gonna address again the top 4 errors that we are noticing. The first one, I have mentioned that the system does expect comma-separated values, CSV files, and all records, basically each row requires a business ID. You cannot enter on the first row and leave it blank. The system will throw it out. It will say null value business ID. It violates the system. So all business IDs need to be entered for each record, and the system does check if it's a 36-digit business ID. As Lesedi mentioned, the ID numbers, the system does check if it's a 13-digit ID numbers, but again, as mentioned before, it does cater for passport numbers. This is where you would append zeros to a passport number to ensure that it conforms to the 13-digit character requirement. And another issue is the date format. While yes, it is also stipulated in the templates, the system expects all date formats on all the templates to follow the following format: the full year, the month in digit, and the day in digits. Anything outside this format, the file will be rejected. And again, these are some of the error messages that are thrown out by the system. And normally after the word constraint, it will give you an indication of what's wrong. And if you do submit a file that has 1,000 records and file number 644, the ID number is wrong, it will reject all 1,000 records. So basically, your entire file must be compliant or it will be rejected totally. So it will not take the correct ones only. So it's either it's all in or all out. Okay, another common issue that we're getting is the formatting of the ID numbers. So by default, Excel is an accounting application. So it will convert the numbers into a more math format. So what we need to do is correct the formatting, as mentioned, into a number format so that the system does recognize there's a 13-digit number. And so how we're gonna do this, we will right-click on the column, the ID number column, select the format cell option, then the format cells window will appear. We then proceed to select the number category and ensure that it has 0 decimal places and click OK. This is when your ID numbers will be displayed as they should be. Again, these are just the top queries that we've had. Other queries that we've been receiving have been unique to certain machines, operating systems, or policies enforced by the different companies on their machines. That was my quick troubleshooting of a CSV file, and I'm open to any questions that I might not have addressed on my presentation. Thank you, Chair.
Thank you very much, Monty. Crisp and clear. So now open to our audience. If you have any specific questions on the troubleshooting during data submission that Monty has shared with us, please just indicate. You can, type questions in the question and answer box, and we've been flexible today to also answer your questions in the chat box, which is reasonably manageable today. And you can raise your hand and I will allow you to open your microphone, especially if you want to do a follow-up clarification. Okay, then Wendy, yes, thank you, Wendy. My apologies. Just your question that you asked earlier, Wendy's just asking if Monty, you could address her question. And it is in the Q&A box. I'll read it to you. I've unfortunately moved it to the answered column or tab. Wendy is asking, in addition, when selecting the preferred data submission process, Monty, and she says, when selecting the CSV file upload, an error message appears saying error updating the business details, please try again. And Wendy says, I've attempted this many times with the same error message. Will this prevent me from uploading CSV data? Monty, over to you.
Oh, yes, thank you, Ashraf. So the option I think Mary is referring to is where you update the business details. This is where it will give you the options to update any information you captured during the business registration form. So the fact that you were able to log into the system already implies that you are registered for the CSV platform. Hence, it will not re-register you for the same platform that you have authenticated into. The only option that, the only reason why that option is there is should you want to change your option from CSV to API or CMO option. But we will, I have noted it down and we will put a more user-friendly notification for that error. Thank you for that.
Unmute my microphone. Thanks, Monty, for that. Wendy, I hope that that helps. If you want to follow up on that, you can certainly do so. Wendy says thank you in the question and answer box. Also, Denzi Groenewald earlier thanked Nisha and Lesedi for the swift email responses throughout the past few weeks. Okay, so the communication is definitely working in that case. So are there any other questions that you have? We do have some time, approximately about 15 minutes or so for this session. If anybody else has got any follow-up questions that you want to raise, please do so. Okay, so Wendy's followed up. Can we still upload data going back to the 1st of August? That's Wendy's question. So that's open to all of our panelists. I'll start with Monty first. Monty, are you able to give us an answer on that one? Wendy Hutchinson wants to know, can we still upload data going back to 1st of August?
Yes, so the system does keep track of all the files that you have uploaded, while it doesn't necessarily keep track of the different symptoms or individuals that you will have uploaded, but you can backdate up until the 1st of August. Any data before that, we do have on the system and it will be loaded for you.
Thank you very much for that, Monty. Wendy, I hope that helps. We seem to have a very satisfied group of participants today with not many questions or any hands being raised. So I'm going to go to our panelists whilst we, you're welcome, Wendy. Wendy says, Monty, great, thank you, with a smiley face as well. So I'm going to ask our panelists while I look out for questions in the chat box, the question answer box, or any hands being raised. If there's anything that you may want to emphasize based on questions we've had thus far and the different presentations we've had. Nisha, Lesedi, Nonhlanhla, Monty, are there any additional comments you may want to emphasize in terms of ensuring that our users would be able to effectively and efficiently use the CSV, the new CSV platform, and the features that it presents? Any of the panelists who may want to just add something? Okay, they're all happy as well. It seems like this is going to be a shorter webinar than we had planned in terms of our time allocation. I mean, originally we did plan it to be an hour. We did ask to consider the additional half an hour, and I think that additional 50 minutes or so has in fact been useful. So, okay, no new questions in the question and answer box. No new questions in the chat box and no hands being raised. I'm going to then just ask our presenters for any final comments before we close. Any final reminders that they may want to share with the audience, and then we will close after that. So maybe starting with yourself, Nisha.
Thanks, Ashra. There's nothing further from me. It's just if there's any issues with the system, you know, we just encourage you to contact us either on those cell phone numbers or the email. And you may not get a response immediately, but we aim always to get back to you within the 48 hours.
Thank you, Nisha. I can certainly share with our audience that there's a very hardworking group of people, not just in the epidemiology and surveillance section, but also the colleagues in the IT department are very much hard at work trying to make sure that all of this works well. Final comments from you, Lesedi?
Thank you, Ashraf. Nothing much really. I think I've said a mouthful in my presentation, but just also to re-emphasize on what Nisha has said, that please do not be discouraged when your email is not responded to immediately, but we are actually aiming at responding to everyone, and we will get to it. Whether it's a technical query, you can always send it to the OHSS workplace, and we will be able to address it accordingly. Thank you.
Thank you, Lesedi. Nonhlanhla, final word from you?
Yes, I would also like to encourage our users to maybe use the resources on our website, the NIOH website. You know, and also there's a report on the work, on the data that are submitted from different companies. So if they can have a look and see where, what we actually doing with their data, maybe that will also encourage our users to continue submitting the data. Thank you, Ashraf.
Thank you very much. Yes, it's always useful to know what the positive outcomes and impacts are of the work we do, both in the workplaces as well as on the OHS system. And then finally, Monty Rambao, my colleague in the IT department, who posts these amazing animal pictures on his WhatsApp status. Monty, final word from you.
Thank you, Ashraf. No, nothing from my side. I know many users had to upskill their IT skills a bit to get to grips with the new system, and we do appreciate the efforts and the communication that we do receive from the users. But yeah, so far, nothing
Further
more
from
from
you.
my side. Yeah.
Okay, great, Monty. So thanks to the presenters and panelists, Prof. Nisha Naika, Lesedi Munayua, Nontlanta Tlotleng, and Monty Rambao for presenting today and answering our questions. And then, our colleague Shanita, Liesel, Jenzik, and as well as Wendy, thanks for your questions. I hope that the session has been a very productive and informative one for all of you. And please do call that cell phone number. If it's not answered immediately, try it again, and also use as an alternative, and sometimes both of them might be useful, both the number and the email address, that is ohsworkplace@nih.ac.za. And please, finally, before closure, do visit our website. The NIH website is zero-rated by all of the major mobile service providers, the cell phone companies, as well as I think 1 or 2 internet service providers. It would mean that you would not be charged any data when you do visit it, and there's quite a lot of resources there. And some of these sessions you will clearly remember specifically deals with the OHSS, in particular this one, updating us on the new developments with regard to the CSV platform and the data submission demonstration. Thank you very much all our presenters and our attendees for attending today. We will definitely let you know via our email notification process of future webinars, both the OHSS ones, as well as the general COVID-19 webinars that we present. There is a lot of resources related to COVID-19 on our website. Please, if there are colleagues of yours in the workplace who may not directly be involved in OHSS, but they are COVID-19 compliance officers, or they are health and safety representatives, or members of the Health and Safety Committee, or managers and supervisors who are responsible for implementing the COVID-19 compliance measures, please direct them to our website, that is www.nih.ac.za. So thank you everybody for attending. We will close this webinar now. Goodbye, see you on our next webinar.
Thank you. Bye.
Bye.
I just need to find my music. There we go.